Hello and welcome to this important conversation about healing through the arts and shared stories from an Asian heritage perspective. I'm Mary Lou Aleskie, member of the Yale-China Association Arts Advisory Committee, which is actually my passion job. My day job is as the Howard Gilman Director of the Hopkins Center for the Arts at Dartmouth College, where I get to lead our arts and innovation initiatives. Core to these efforts at Dartmouth has been developing and implementing an arts-centered and arts-integrated approach to learning and research across all academic disciplines. This work is based in the belief that with the arts at the center, we heighten the possibilities of addressing some of the most pressing human needs. And our guests today are two professionals who I think actually share this belief and perspective. By exploring storytelling and theater as an avenue for wellness, mental health, and healing. One is an artist and one is a clinical psychiatrist. And so these interesting perspectives will come together in our conversation. This is particularly interesting now to have this conversation about mental wellness in the Asian community, especially as we're dealing with an uptick in violence in this past year that's taking a damaging toll on people of Asian heritage. So creating a burst of energy around AAPI, activism, education, and of course arts is a way forward as we build strength in our community through these arts-centered initiatives. So let me specifically introduce our guests today. Today, I'm with Onnie Chan. Onnie is a Hong Kong-based theater artist. She's a founding force of an immersive theater collective called Banana Effect. The collective creates theater experiences that take on truly important issues in often playful ways, but that are impactful and illuminating. Among her many artistic achievements, Onnie is a Yale-China Arts Fellow, the fellowship supported by Hong Kong Economic and Trade Office in New York. While she was in New Haven in 2017, she produced and created an internationally and simultaneously performed interactive play based on a mahjong game called Never Stand Still. And I have to say, internationally and simultaneously performed before the world of Zoom. So a real groundbreaker. Thank you, Onnie. It was adventurous. It was an adventurous production, even in the context of the always adventurous International Festival of Arts and Ideas, where it premiered when I was the festival director. So we go back a ways, Onnie, and I'm so glad to see you again. Dr. Eunice Yuen is a clinical fellow at Yale Child Study Center. Dr. Yuen integrates her clinical training and research work in a bio-psycho-social cultural framework. Her research in children's mental health covers from basic science on genetics and neurobiology to community-based advocacy, education, and intervention. Aculturative stress, a form of psychosocial stressor that is experienced by most immigrants, negatively impacts children and families in our society. Dr. Yuen is the founder and director of Yale Compassionate Home and Action Together, otherwise known as CHATogether, a culturally and family-oriented program using drama vignettes as educational tools to promote emotional wellness in Asian American children, young adults, and parents. Dr. Yuen, this is a really unique approach to use theater in a clinical atmosphere, adding the cultural layer to it. Please, let's start with you. Would you tell us more about your work and what is happening to overcome these traumas in the Asian American community?
Yeah, thank you, Mary. Thank you for the kind introduction. And thank you so much for having me on this call. So yeah, sure. So I want to introduce CHATogether as we talk about Yale CHATogether acronym stand for Compassionate Home Action Together. We are a community education program serving for the Asian American families. We actually started more than a year from now in response to the COVID-19 pandemic, where we realized the unique emotional distress faced by Asian American families. The family conflict, cabin fever, xenophobic attack, all the anti-Asian hate crime, all that sadly escalated across our country in the past year. As you mentioned, we are using interactive theater as a way to address emotional wellness in Asian American family. Our program is culturally and family oriented, aimed to really create a healthy communication skill to child and parents. I guess I take the opportunity to describe what we do in our group. We started, I guess, really by occasion in the past year as we have more and more members who join us. And then our own members have a common denominator. We are passionate about the AAPI community, and we use our personal narrative as a way, like our own story, that how we interact with our family at home, and create skits that about child-parent conflict around household, especially first generation immigrant as parent, and the second generation as teens and young adult. So topic could be around academic expectation, like how we decide on one's major in undergraduate student or high school student. That could be a really conflicting situation during the pandemic. Also, it could be like a skit around like mental health issue, first time seeing a psychiatrist with mental health concern, but parents perhaps may be very reluctant to talk about it or may not have much understanding about mental illness per se. So how do we kind of reconcile those conversations in a more healthy way? We also have skits about cross-cultural issue, cultural diversity, such as how parents and children talk about society issue happening in the pandemic, like Black Lives Matter, anti-Asian hate event occurred sadly in Georgia. And like many parents are really desperately wanting to know how do they talk about anti-Asian racism and how do we talk about the conversation with the children. And so what we do is that we have actors, like one acting as the teens and one acting as the parent. And we design act out a problematic scenario where they will have conflicting situation and where the child and parent may have very different, differential point of view on a certain topic. And then myself will be as a moderator. We walk into the situation to debrief and to discuss what could be discussed differently in the conversation. What could be some more healthy way to approach it? And then after that, the two actors, where we do the whole skit after incorporating some of this healthy coping skill and after the moderation. So we I guess that because of the pandemic, we adapt everything on social media. We used to be like doing it in person, and now we adapted making all these videos and share on social media. We also have holding virtual skit event to engage our audience across different places across US and even sometimes to show in Hong Kong as well. So I guess these are the nutshell of like what we do, mostly incorporating mental health and theater work and how to create a really safe space for people to feel safe enough to talk about really stigmatized topics.
That is so interesting. And the actors in these skits, are they professional actors, or are they other patients or interpreting stories?
Yeah, we thought about hiring for professional actors, but we decided we have actually a volunteer. They are all students. They are either like undergraduate student, graduate student, international scholar. Some of them are parents. So and it's interesting that like even if we are not professional actor, but the process of creating the story, creating the skit, and being actor in the skit is actually a profound therapeutic experience for the person. So we decided to not to hire professional actors, but we over time we learned some improv technique. We have colleagues who have drama, improv, community theater experience to guide us in the process.
That's fantastic. That's so fantastic. Now, Onnie, I want to bring you into the conversation. You obviously you're a professional theater maker, and you have done a production called Echo in Labyrinth
Yes.
production. And we're fortunate enough to have a filmed version of the production that will be streamed and available through Yale-China. I'm fascinated by this other way of looking at things, taking these stories of mental health and sharing them through a professional lens. Can you talk about the production and your experience in building this production and talking about mental illness in Hong Kong?
Yes, of course. First of all, thanks, Mary Lou, have introduced me in a very nice way so that everyone could briefly know what I usually do and what my company produces as well. So first of all, I want to tell you guys why we start this project, because I think it's very important for an artist or creator to tell the reason why it's so important to create these particular artwork at this moment. I guess at the beginning, we all has experienced, even though it's not in a pandemic situation, the world is going chaotic and crazy. Like, there's terrorism, there's even environment issue, or it's a lot of stress to leave or work. So there's so many tension in our life, especially people in Hong Kong, because it's a very packed environment. So we don't got much space and time. It gives us stress. And however, even though the places are small and packed, we also lack of communication too. So people kept so many stress and worry among themselves instead of share it with the others. Eventually, it caused some problem in the mental health. So it happens not just among friends, among people that's around me, but I also noticed that it's become a phenomenon in Hong Kong, that people started to have depression. Even it leads to a more worse results that people commit suicide. So that is what we wanted to avoid when we do a show. We want people to have more positive, attitude to life, and also try to have more empathy of what is happening to the others as well. So we felt that there's an urge to investigate and discuss about this topic through art, just like what all you guys are doing right now. We know how important it is. So in the old days, as Mary Lou said, that we usually produce immersive theater so that audience could experience what we wanted to produce or impact on them right away. So it will have a very strong and provocative feelings and also thought as well. However, because of the pandemic situation, we have to change it into an online platform. So instead of doing an immersive show, we change it to a physical theater presentation. However, through these changes, we actually explore more about people who suffer in mental health issues, how they react, or sometimes, they couldn't express it through words. They can actually just express through their physicality to show how depressed they are, or sometimes they tend to maybe hide their feelings and emotions. But because if we show their physicality in our show, the other people's audience, they can actually be more sensitive to the people around them. So this is the initial ideas of why we're doing the show. So how we begin, instead of just, going online, do some research or just create a character, we wanted to get it more close to the real situation. So we start with having interview with people who really suffer in mental illness or mental disorder, or just simply feeling sad or depression in their daily life. So we did so many interviews with my team. Some of the actors go interview, some of the designers go have interviews as well. And eventually we found that there are 5 very I would say interesting in a way, but also actually some of their lifestyle or their habits or stuff is actually very common in Hong Kong. Or I would say people who live in the city that would normally how they experience life. So we felt like, if we present the stories to the others, they could find strong connection with the characters. So to understand more what happened to them. So the whole story is actually based on 5 true stories. And during our investigation about the mental illness and the relationship between the lifestyle and habits living in the city, we realized that sometimes having this mental illness, it could be caused by some changes in the society, or maybe the structure of a city itself. So we actually also point out some of the problem or issues that's happening in the city right now, like the structure of a city that maybe people are always thinking about fight and flight in the work. So that's why they have to give themselves so much pressure and stress because they want to win and so on and so on. And then why they wanted to win, maybe they want to prove to the people around them or their value of life. It caused them to have all these mental health issues. So this is like the process how we create the show. And eventually, as I said, because of the pandemic, we couldn't show it live and in an immersive way. However, we still want audience to get really close to dig into the health issue problem. So actually, if you're going to see the show later, if anyone who's going to see the show later, you can see that we shoot it in different angles. So then you don't only see what happened to the patient in one angle, but in all different kind of angle. It's just like, when you hang out with your friends, you don't always look at them in just one way, just like in this dimension. You have to be more sensitive to feel the atmosphere around them, to notice that what they are going through, what they are suffering. So this is one of the point I wanted to let you guys to notify when you watch the show, to see things all rounded. And the last thing I would like you guys to also keep an eye on in the show is because we don't have much setting. When I say set, it's like a physical set, like so many tables or so many chairs or a beautiful architect. We didn't do that because we want you to focus on these people's feelings and how they react to their own suffer. That's why we wash away all this fancy setting, fancy props. But we keep 3 things. A door, D-O-O-R, a door, open the door. Mm-hmm. Why we do that is because in Chinese, we have a say that 心靈之牆. It's like we said in our soul, there's a window. When you open the window, you can see so many different things. When you close the window, you're close to yourself. However, in the show, I use the metaphor of a door because it feels like you open the door, you can walk outside to see what happened. Window is like if you jump out, it seems like you kill yourself. So we use the door. So when you see, when you see the actors or the performers, they open the door, it really signifies something. So I want you to keep an eye on the door, and this kind of a fear comes to them as well. And the second thing is a string, a white string. So really pay attention as well when it appeared. It actually also is a metaphor about giving some kind of hope. But there's more on that. I won't give you too much information about that. It's kind of like saying it's a hope or some connection to help these people who suffer in mental illness. And the third thing is at the very beginning of the show, there's one character draw a painting, and we will review the painting by the end of the show. So these are some elements I hope you guys could pay attention into the show.
Well, that's fascinating. That's fascinating, Onnie, and I can't wait to see it. For the both of you, it seems to me you're doing an amazing thing on both sides of this conversation about theater. But the fundamental thing that you both need to do is create a certain amount of trust, to get people to feel empowered to tell their stories and to overcome, you've both referenced these stigmas about mental health. So what tactics have you used to empower people to tell their stories and to overcome this stigma, to get people to feel comfortable admitting that there are issues that are out of sync with them? For both of you,
Maybe I will go first because mine seems more simple. First of all, because, my team, my creative team, because we work together for a very long time. It's almost over half years. So we always stay together. I think that would be more easier to build a trust. However, I think this is also an important question because, as I said at the beginning, we have to do interview with people who really are suffering mental illness. So most of the time, we just go one-on-one interview and then come back to the group and then share and discuss as well. Because we also know that if the whole group of creative team is going to have an interview with one person, that would definitely give pressure for that person. On the other hand, when we started to think about the person that we want to interview with them, is mostly actually friends or people we already know, so that they feel safe to share about their experience. However, the second thing, of course, we have to notice them that, is it okay for us to share this story with the others? I guess as long as they know the meaning of the show and how much impact the show could make, I felt like, they also feel comfortable to share all this information to the world. And they also noticed that, especially, sorry, I want to say one story if there's enough time, just for sharing. In the show, I got different age people as well, and I aim to find one old person. I think her story is the most inspiring because she has been suffering for a long time, and we also noticed that we can't just say, oh, mental health is just like a flu. You can eat medicine and it will get cured. No, it's a very complicated topic that we have to discuss. So that's why when I saw her, or when I noticed her story, I realized she actually giving hope to the others. It's not like, oh, I'm going to get healed and everything is going to be bright and sunshine again. This is going to come with me all along. But I'm strong enough to stay with this mental health issue and still live happily and healthy. So that's why I think that is the big impact that we got. And I also think that maybe trust is the most important element in my situation.
And Dr. Yuen, how does that translate into a clinical situation?
Yeah, I guess I want to follow up with what Onnie, brought that up about setting up the framework of like creating safe space. I think psychologically, I think like storytelling itself, why it is so powerful and healing. I feel like it is like both for the storyteller and also for the story listener or story viewer. I'm thinking about that like deeply lately. For a person to be able to share the story, they need to verbalize the thinking, the feelings in a really coherent manners. And also sometimes like the story you share is really like a learned painful experience or even like some sort of trauma that happened in the past. And I think like, for example, in our CHATogether members, like we really use a personal story to create a skit based on the narrative. And I think like we actually create a qualitative study to do a focus group among our CHATogether member. What is it like for the experience by creating skits based on the storytelling, based on the narrative? It actually like we found that it is a way to practicing in a way that projecting the painful feeling into something imaginative, into something productive, especially happen in pandemic, and also into something that meaningful for other people. So it's like a really mature coping mechanism that you are altruistic and helping other people and also helping yourself in the process. And so they find that it is coping, it is healing, especially during pandemic when everyone is so isolated and like have like really out of the control to do something, they find that like doing this is in a way in control of what they cannot control in their mind. So it is really, it really wonderful and compelling using storytelling in addressing mental health issues.
It's so fascinating. You know, you both have worked, obviously you're in Hong Kong, you're in New Haven. New Haven is a place where it's a community that has a lot of trauma from lots of different perspectives. Dr. Yuen, how transferable do you think your practice is to other cultures and other atmospheres? And how important is it that we have an Asian perspective with Asian clinicians in treating Asian trauma?
Yeah, I guess I speak to the first question first, like our work. I think the unique thing about theater and storytelling is that like it can go so many different ways. Like I'm not saying that it will only applying for only one culture versus the other, because it is just so uniquely, it's a narrative based on, you know, one person story experience, and it is really goes so many variety different ways to describe one's life. And so I think like it is very potentially applied to other culture as well. We have a story and from other culture, from other ethnicity. And I think as a viewer, it will be able to provide a learning environment to understand each other, intercultural empathy, to be curious, not judgmental, to learn about each other's story. So I think that is really fascinating in terms of using storytelling and theater as a way to address this cross-cultural issue. And I guess like from the mental health perspective, I can talk about that. Like maybe I provide some statistic to like how Asian American mental health has been a very overlooked issue, as Onnie like described. It's even way before pandemic, and pandemic even escalated to another level.
Yes.
And really sadly, Asian American, like at least in US, we are 3 times less likely to seek mental health provider compared to any other Americans. This is according to a national, according to Substance Abuse and Mental Health Services Administration. This is in 2019. And sadly, suicide is still the second leading cause of death among Asian American women for the age between 18 to 25. And really, like we are as clinicians, we have not been talking enough. It's such a horrifying statistic, but we have not been talking enough. And I think like we also kind of like alluded to the point that Asian American tend not to reach out to services like until they are really in the emergency, psychiatrically emergency situation. I see them mostly in the emergency room or inpatient psychiatric floor, but not reaching out as an outpatient, more benign level. And oftentimes, as you mentioned, mental health has been stigmatized overall, and even more so in minority population, including Asian Americans. And in family, like I see teens and adults most of the time, and oftentimes Asian American teens, they do not get adequate support from the family because it is so stigmatized. So even talk about mental health and feel dismissed by the family and the community. And also, sadly, there are not many of us that we have like, you know, having a cultural background and to be able to relate to the patient. That's one hand, and also having the lens of looking at what is the cultural component in this clinical presentation. They do present differently. For Asian American, I guess that we are, you know, make to work as hard. Like even some of our patients like meeting depression criteria clinically, but they're still able to perform at work. They still be able to perform at school. So typically many clinicians will miss that, oh, maybe this patient may need help, maybe that's not reaching to a severe level yet, but although already meeting clinical depression criteria. So in a nutshell, just to say, it's really lacking the culturally oriented mental health.
Yeah. Well, we have just a thank you for that. We have just a minute or two left, and very quickly, I just wanted to ask both of you. Your practice is not only impacting people, but you're changing. It seems to me like you're potentially changing your fields. So, you know, Dr. Yuen, you're talking about a shortage of Asian clinicians. You're talking about a new practice that involves theater. Onnie, you have the potential for changing the power of theater and how it reaches people. Tell me how you, in a very quick way, tell me what you believe is the potential for this in impacting your field. Onnie, let's hear from you first.
Thanks Mary Lou for these great questions. So I could have an opportunity finally tell the others why I have to do this kind of a theater performance, and also the way how I present my artwork as well. I have a very strong feeling for people nowadays, as Ernest said, that people started not talk too much about things. They tend to work it out, like just work and maybe stick to some kind of formula and so on, but they didn't want to talk so much. So in my theater as well, I felt like sometimes language can trick people, because we're so smart, especially people nowadays. We're very smart. We tend to say some beautiful things and so on, so we could skip something important to let the others actually understand ourselves more. However, I always have a strong feeling that the hearts couldn't lie. Like, this kind of feeling is instantly. So when you go into a show and it gives you strong impact, it triggers some of your feeling that has to be true. However, if you are seeing a show and trying to analyze those words and situation and things like that, maybe your mind tricks you and turn you into some other kind of thoughts. So that's why I wanted to create a theater which provoke strong feelings for the others. And they started to rethink about their life. And also, this kind of feeling could stay in their heart for a longer time and make influence or even ripples in their life. So that's why I create immersive theater. Even though now I couldn't use a live immersive way, I still wanted to use a physical theater, but turn into an immersive virtual way to introduce some mental health topic to the others.
Fantastic. Thanks, Onnie. And Dr. Yuen, how about you? How do we get more Asian clinicians and change the way that we treat people?
Yeah. I guess one cannot do it all, but I just feel like the theater work that Onnie and I has been doing, moving the field to the next stage that, as I mentioned, stigmatization is such an issue in Asian American mental health. And I think this program really create a so-called prevention model in mental health. Before you get to mental illness, why don't we take care of our emotional wellness? It's like going to a primary care doctor, doing an annual checkup. You take care of your physical health. Doing exercise, yoga, you can also take care of your emotional wellness. And I think also I want to put it into more a family model as well, because I work really involved in children, parents, and then want to speak to the parents. Parents can have a way to make influence of their children's mental health by paying attention to strengthening the relationship with them, communicate with them. You can have a better way to influence, have a positive impact to your child mental health, giving them a better emotional capacity to succeed in life, no matter it's in school and work and future healthy relationship with a loved one in the future. So that is that's that. Yeah.
Well, that's beautiful. And I think that that's a great place for us to stop, all about creating wellness and future. Thank you both. This has been a wonderful conversation. I hope that I get to see both of your work. We know we'll see Onnie's. Please check out the CHATogether and get involved in the conversation at Yale-China's Yale Child Study Center with Dr. Yuen, but also don't miss Yale-China's limited engagement showing of Echo in Labyrinth. It runs from July 26th through August 1st, and the production's viewing is made possible by Banana Effect, Yale-China Association, and the Yale Community for New Haven Fund. And you can learn more about it at yalechina.org. /echo. Also, just one more thank you to Hong Kong Economic and Trade Office in New York, who's made so much of the fellowship possible at Yale-China Association. It's been a pleasure. I look forward to seeing you both again. Thank you for joining us. Take care.
Thank you, Mary Lou. Thanks.
Thank you all. Thank you.